Good afternoon. Thank you for joining us for today's webinar, Alzheimer's and Other Dementias, a Growing Public Health Challenge, Ways to Educate, Empower, and Engage. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit questions using your questions pane on the right hand of your screen, and our presenters will address them at the end of today's presentation. Today's webinar is being presented by Sara Murphy, Vice President, Programs and Services for the Greater Pennsylvania chapter of the Alzheimer's Association, and Melanie Smith, Director of Care and Support with the Delaware Valley chapter of the Alzheimer's Association. I'll now turn the webinar over to Sara.
Hi, thank you so much, Wendy. It is an honor to be here representing one half of our state of Pennsylvania in care and support. Again, my name is Sara Murphy, Vice President for Programs and Services with the Greater Pennsylvania chapter of the Alzheimer's Association. I just want to thank Wendy and everyone with the Pennsylvania Healthcare Association. We really value our partnership, and this is definitely something that we are looking forward to presenting to each of you all today, as this is the month of June, which is Alzheimer's and Brain Health Awareness Month. And so I'm going to pass this on to Melanie to do her introduction, and as she's doing that, I'm going to start to share my screen.
Thank you so much, Sara. And again, thank you everyone for being here with us today. And it's really our pleasure and honor to provide this presentation to you. My name is Melanie Smith. I'm the Director of Care and Support for the Alzheimer's Association Delaware Valley chapter. And to Sara's point, both of us together represent the entire state of Pennsylvania. The Delaware Valley chapter covers 8 counties in Pennsylvania, which is Berks, Bucks, Chester, Delaware, Lehigh, Montgomery, Northampton, and Philadelphia. So thank you all, and I will let Sara take it away.
Okay, great, thank you. So, as I mentioned earlier, you are joining us as we close in the month of June, which is Alzheimer's and Brain Health Awareness Month. And we're so excited again to partner with the Pennsylvania Healthcare Association. During this month of June, we'd like to be able to raise awareness about Alzheimer's disease and all other dementia. The more people know about Alzheimer's disease, the more action we can inspire in our communities that we serve across the Commonwealth and across the nation. And I would be, it wouldn't be fair if I was not to also mention some notable news that has come out. A huge victory for the Alzheimer's community happened just a couple of weeks ago when the FDA approved the first treatment in close to over 20 years. Well, that will not just treat the symptoms, but slow the progression for those living with mild cognitive impairment and early stages of Alzheimer's disease. And so this is really a true look at translating research to reality and setting the stage for what's to come, for continual success and advances in research. And so wanted to just open that up and acknowledge that, and acknowledge the work of all those that have been involved in this momentous and victorious occasion with the Alzheimer's Association and the entire community. And I'm sure each of you have seen the news and heard about that. So I wanted to start it off, kicking it off with that. And throughout today's discussion, we really will actually talk a little bit about research, really more about where there's hope on the horizon. But really, we're going to set the tone for identifying the prevalence of Alzheimer's and dementia and the impact that it has on American families, including risk factors, the impact of caregivers and cost of care. which a lot of you all know the impact that it's having, with families, especially with you all providing care and support within a long-term care setting. Providing supportive resources for caregivers and families. So we want to make sure that each of you are aware of the free resources and some of the training as well that we have through the Alzheimer's Association. And then we're going to talk a little bit about Alzheimer's and other dementia, why it is really continuing to be growing a public health challenge, outline some of our public policy efforts, both locally and on a federal level, and really ways that personally, if you want to get involved and to get involved in some of the advocacy efforts, we'll talk a little bit about how to do that towards the end of our presentation today. And so I will be doing the first part of the presentation, and then I'm going to pass it on to my colleague Melanie to talk a little bit more. And so our mission with the Alzheimer's Association, we are relentless in our work to enhance care and support for people living with the disease. We really do seek to leverage research to help eradicate Alzheimer's disease. We are the leaders of the cause. Our greatest strength comes from our relentless and multifaceted approach to end Alzheimer's disease and all other dementia. And so with that, I know some of you have probably worked with us before, whether it's on a professional level or a personal level, have probably connected with us. But our mission is very clear and powerful. Our mission, we're leading the way to end Alzheimer's and other dementia, accelerating with global research, driving the importance of risk reduction, early detection, and really being able to maximize quality care and support. And so every year on this slide, I'm not going to go over all of the statistics. You actually can download this report on our website. If you haven't visited our website, alz.org/PA, you can actually download the full report. But every year, the Alzheimer's Association reports releases the 2021 Alzheimer's disease facts and figures reports. And really what it outlined this year is really the heavy burden of Alzheimer's disease on individuals, families, and society really continues to grow. And as you see outlined here, more than 6 million Americans over the age of 65 are living with Alzheimer's disease today, and it's expected to more than double to 12.7 million by 2050. We see that 1 in 3 seniors dies with Alzheimer's disease or dementia. And as we also look at too with COVID, as a result of COVID, there were over 42,000 more deaths from Alzheimer's disease and other related dementia in 2020 compared to averages over the past 5 years. And so we saw about a 16% increase of deaths due to COVID. And another piece that we see, we'll talk a little bit about cost of care, but as we look at too, there was a special report that was featured within our 2021 Alzheimer's disease facts and figures that talked about the discrimination is a true barrier to Alzheimer's and dementia care. And so there was a study that was done that actually reported out, and you'll see the different demographics of Black Americans, Native Americans, Asian, and Hispanic Americans that reported that discrimination was a barrier to Alzheimer's and dementia care. And so we saw the study that reported out that these populations reported discrimination when seeking health care. And so what we're striving to do is make sure that we are reaching and connecting with these audiences, and we'll talk about in a few minutes, the higher risk and prevalence as well within these populations. So we see that Alzheimer's disease and dementia is becoming a public health issue because as outlined here, and you'll see on the slide here, the burden is large, the impact is major. But as we talk about here in a few minutes, there are ways we are learning to intervene and talking a little bit more about the risk factors. And so now we're going to discuss a little bit about the basics of Alzheimer's and dementia, but really the opportunity to level set. And so most of you probably joining us today do understand, right, the difference between Alzheimer's and dementia, but sometimes it's good to have a baseline understanding. And so as you see here, the overall term dementia, as a visual learner that some people are, is an umbrella term used that are many types of dementia, and Alzheimer's disease is the most common cause of dementia. So dementia is really that syndrome or that collection of symptoms. It's really what that person experiences. So it's not what causes the experience, The umbrella term, as you see here, there's many different forms of dementia, right? We talked about Alzheimer's disease is the most common type, currently makes up about 60 to 80% of the cases. And then you'll see some of the other causes: vascular, Lewy body, and frontal temporal dementia. And on a personal note, I know my grandmother had suffered with vascular dementia. She had a stroke and fell and went into her nursing home, and we saw the stair-step decline, right, that we see typically with vascular dementia. And so as we talk a little bit more, Alzheimer's disease is a disease or that biological cause of dementia. And so dementia really means that a person's cognition has declined and to the point that it interferes with their ability to do their activities of daily living. And we do know that some causes of cognitive decline are actually reversible and not truly dementia. So as we talk about the public health piece to Alzheimer's disease, we also have to understand here what could impact risk. And so we're learning more and more as more clinical trials and more research is being done. We're starting to get a better understanding of ways to potentially have modifiable risk factors. And so on this one slide, you'll see that there's non-modifiable risk factors, so things that we can control versus what we can't control. And so on the purple side on that bubble, you'll see that, of course, age, as you looked at the facts and figures on the other slide, age is the greatest risk factor for Alzheimer's disease. We know that 1 in 9 over the age of 65 has Alzheimer's disease. We also know that there's a family history or link, so genetics, in addition to race and ethnicity. And we'll talk a little bit more about the prevalence in those different target audiences. But as we're starting to understand more, essentially, Alzheimer's disease is not a typical or normal part of aging, and it has many causes and risk factors. Although we don't fully know what causes Alzheimer's disease, but any given moment, researchers from all over the world, funded by the Alzheimer's Association and other agencies, are making discoveries that will help us answer this. And so, as we talked about with age is the primary risk factor, it's also a primary risk factor for some types of cancer, but no one thinks of cancer as a normal part of aging. And so what we are starting to understand, there are some modifiable risk factors, and how are we getting into the general public, and how are we acknowledging and understanding risk reduction and risk factors for potential lowering your risk for cognitive decline later in life. And as you see outlined here are just a few of the modifiable risk factors, including environmental lifestyle factors, cardiovascular health. The Alzheimer's Association has a fantastic program that talks about healthy living for your brain and body. So what's good for your heart is good for your brain. We do know that people that are higher risk for cardiovascular issues like heart disease and stroke are at greater risk for dementia later in life. The importance, and we all know this, right, of physical activity, the good oxygen flow that it's produced when the heart rate is up, that's really good for your brain health. The importance of sleep. There's been quite a number of sleep studies that talks about sleep apnea and at greater risk for cognitive decline. Social cognitive engagement and education. So we do know that, use it or lose it theory, the opportunities to be able to stay socially engaged and cognitively, including that engagement, is going to be important. And education as well. Traumatic brain injury as well has been proven to be and also a modifiable risk factor. So in addition to those main risk factors for the general population, we do know that Hispanics, African Americans, and women are at greater risk for Alzheimer's disease. Research shows that older Hispanics are 1.5 times as likely than older whites to develop Alzheimer's disease, while Black African Americans are twice as likely. And so while not 100% sure, researchers believe that higher rates of vascular disease, and when we talked about this cardiovascular health as being a modifiable risk factor, we see that there is a higher rate of vascular disease in these groups that may put them at greater risk. And so with that in mind, knowing that, yet they're less likely to receive a diagnosis, as we talked about in the disease research report, that there is a clear understanding that these groups do not seek a diagnosis and have felt discrimination towards getting an access to care and diagnosis. So what can I do to reduce my risk, right? I think that's one of the main questions that we get when we're doing general education programming in communities. And what we're finding, and again, where there's hope in the horizon, where there's hope in research, is research is suggesting that combining multiple healthy factors, lifestyle factors, may be the most impactful strategy for delaying onset of mild cognitive impairment and dementia. And as we talked about earlier, the importance of understanding that is just as important, and knowing that there's continual clinical trials looking at more effective treatments. We talked about in the top of this presentation, the treatment of Alzheimer that just came out. There's more treatments potentially in the pipeline that's looking at these. So some of the strongest research to date suggests controlling that cardiovascular risk factors may be helpful in delaying cognitive decline, right? So one example is the Sprint Mind study, which some of you might have heard of this. This was a study that was conducted in about 2009 and 2010, that a few years ago, that found that controlling blood pressure to 120 systolic decreased risk over about 19% for developing mild cognitive impairment and dementia. And so what we're finding is that what's good for your heart is good for your brain. And so how are we being very proactive and talking about risk reduction and the importance of cardiovascular health when we're looking at your reduction of cognitive decline later in life? And so we see here, what we're finding is talking about the importance of physical exercise and engagement, a healthy diet, how are you fueling your brain, and that cognitive and social stimulation really are what we're looking at, is that lifestyle intervention, those combinations that really is going to be impactful to potentially lower one's risk. And so with that in mind, I mentioned about clinical trials, and I mentioned about where there's a lot of hope on the horizon. At the Alzheimer's Association, we love our acronyms. This acronym, U.S. Pointer Study, happens to stand for the U.S. Study to Protect Brain Health through Lifestyle Intervention to Reduce Risk. And so with COVID, we had to put a halt on some of our clinical trials, but happy to say that we have reignited, and the Alzheimer's Association, this particular study, the Alzheimer's Association has embarked on a large-scale clinical trial that's actually studying just that, what I talked about lifestyle intervention, and studying how that multi-domain lifestyle intervention and its impact on reducing risk for cognitive decline. And so the U.S. Pointer Study is located, as you see there on that map, in several, 5 to 6 or 7 sites now. We've actually included 2 additional U.S. sites that's actually studying just that. It's actually studying whether 2 different lifestyle interventions, encouraging physical exercise, healthy diet, and those cognitive and social activities and overall health monitoring, can potentially reduce your risk. And how is that impacting memory changes in older adults that are at typically greater risk for memory loss? And so there are some stipulations, right, in order to participate. We have approximately 2,000 to 2,200 participants currently with those sites. And like I said, there are some stipulations. They have to have risk factors. They're in that age range of 60 to 79. If these interventions are proven effective, this study will help to lead the way, essentially, in the development of an accessible and sustainable community-based program for prevention. So when we're going to be talking about Alzheimer's disease in communities, it's really going to be, how are we integrating our message about risk reduction to all audiences and not just older adults, but how can we talk about it with people that are at greater risk, like women and the other populations we talked about, and working with departments of health and working with other entities. How can we integrate brain health messaging into heart health messaging? And so you'll start to see that that really is going to be an increase in how we're talking about Alzheimer's disease and dementia in communities, and talking about the importance of risk reduction. So that is just one study of many. And so as I wrap up the research part of this, and where there's we're talking about risk reduction, we have a fantastic app. So there's an app for everything. But if you haven't heard of this already or downloaded this of any smartphone, we have the Alzheimer's Association Science Hub app, where if you want science and research at your fingertips, you can download this app, and it has a lot of really great viewpoints that are accurate, that talks about the different studies that you'll see out there, viewpoints and blogs, and really something that is most up to date. In addition to resources, there's great resources as well for clinicians on here. So a fantastic resource that anyone can download on their smartphone to learn more. So as I wrap up my section, I'm going to talk a little bit more about the impact of caregivers and cost of care. So as we tee up the fact that this Alzheimer's disease isn't just an aging issue, right? It is a public health crisis and issue. And the impact that it's having on our caregivers, as you see outlined here, people age 65 plus are surviving an average of 4 to 8 years after diagnosis. Yet some can live as long as 20 years. And again, on a personal note, my great uncle lived about 20 years with a diagnosis of Alzheimer's disease. And that impact of caregiving really starting to put that emotional and physical toll on that caregiver and for anyone in that support system. Individuals with Alzheimer's disease are going to spend about an average of 40% of the time, typically in the most severe stage. And so as we talked about the changes in the brain, the ability to do their activities of daily living starts to decline as the disease progresses. And so as I've been teeing up, because of that duration of the disease, it really does contribute, unfortunately, to the significance of the public health impact of Alzheimer's disease. And so when we think about who the caregivers are, and this really goes back to the importance of, as we're talking about the importance of education in communities and the importance of being able to, who are the caregivers and how can we make sure that they are equipped with the information and support that they need. Over half of primary caregivers are taking care of their parents. So we're talking about that sandwich generation where they're actually taking care of their family in addition to their parents. And we do see that 1/4 of dementia caregivers, are the sandwich generation. 2/3 of caregivers are women. We're seeing, unfortunately, that women are at greater risk for Alzheimer's disease, but they also are taking on that caregiver role. And about 1 in 3 caregivers are over the age of 65. Maybe necessarily they're taking care of their spouse or another family member. And one thing to mention here too is that about 41% of our caregivers have a household income of $50,000 or less. And so we're seeing that the impact of the cost of care and that burden really puts a toll on the family and individuals. And as we talk about cost of care, Alzheimer's disease is a threat that only is going to get worse as the trajectory and the increase of people with the disease. And so it's important for us as a nation to further its investment essentially in Alzheimer's disease research. Right, we talked about some of the hope of the home horizon and some of the clinical trials that are out there, but it's also, important for us to invest in that research. And Melanie's going to talk a little bit about some of those efforts we're doing on a local and federal level. But to continue to advance public policies and to be able to expand care and support programs to help all those that are impacted. And the exciting part is really, or what's difficult is in 2020 marked the 4th consecutive year that the total payments for care for Alzheimer's disease and related dementia are going to exceed $250 billion. And so the impact that it's having really is large. And we cannot, wrap up my part of my presentation without acknowledging the impact, as we talked about at a few slides ago, about COVID-19 and dementia. So, as we know, the impact of COVID, I'm sure in a lot of facilities that you all represent, was insurmountable and very heartbreaking and very challenging and difficult. And so what we know is that most likely dementia did not increase or does not increase risk for COVID-19, just like dementia doesn't increase the risk for the flu. But we did see a significant impact of the dementia-related behaviors, increase the age, the common health conditions that accompany dementia, increases their risk for getting COVID-19. For example, like forgetting to wash your hands as an example. In addition, diseases like COVID and the flu, what may worsen the cognitive impact as well due to dementia. And throughout this entire year and a half or process, the Alzheimer's Association made sure that we provided the resources and COVID-19 care and support tips and strategies for those that were caring for their loved ones in the home, in addition to the long-term care settings, and knowing and being a trusted advocate and resource as well for the Pennsylvania Healthcare Association, and making sure that we were providing those resources and support during this horrible time during the pandemic and the continual pandemic as well. So with that in mind, I'm going to wrap up my section now and just kind of set the tone on, we talked about the impact of the disease, the prevalence, a little bit about research, and now I'm going to turn it over to Melanie, who's going to talk a little bit more about our resources that we have at the Alzheimer's Association and some of our volunteer opportunities. So Melanie?
Thank you so much, Sarah. My pleasure. So I'm happy to address a lot of our resources that we have available, one of which is probably one that we find is most accessed, which is our 24/7 helpline. The Alzheimer's Association 24/7 helpline is available around the clock, 365 days a year. It's a free service, and specialists and master's level clinicians offer confidential support and information to people living with the disease, caregivers, families, and the public. Anyone can contact helpline day or night. And some typical issues that we hear people call about are information about legal, financial, and care decisions, as well as treatment options for managing symptoms. You can receive help in your preferred language through our bilingual staff or translation service, which accommodates more than 200 languages. And you can also find out about local programs and services in your area, as well as symptoms of Alzheimer's and other dementias. We also have virtual programs, which are free online e-learnings, and they're available at our website. Some of the titles that we have, and we have many of them, our most popular ones: 10 Warning Signs, Understanding Alzheimer's and Dementia, Effective Communication Strategies, and Understanding and Responding to Dementia-Related Behaviors. And we're really excited to let you know today that while we've been operating in a virtual environment throughout the COVID pandemic, later this summer, we're going to start to offer in-person programming. So these programs will also be available in person as well as online in this training session, as well as scheduled throughout the month. We also have a dedicated site called All's Connected. It's our online community for everyone affected by Alzheimer's or another dementia. All's Connected members can share their questions, experiences, and tips via message boards and chat rooms. We find this is very popular for people to connect and to find others, and sometimes even in lieu of a support group where they can find people 24/7 as well and speak to them about their personal experiences. We also have Alzheimer's Navigator. When facing Alzheimer's disease, there are a lot of things to consider. Alzheimer's Navigator helps guide caregivers to answers by creating a personalized action plan and linking you to information, support, and local resources. This is designed specifically for individuals with Alzheimer's disease and their caregivers, and helps guide you to answers by creating customized action plans and providing access to information, support, and again, local resources. We know how important that is for everybody. We also have a community resource finder. It was launched in 2014 when we combined forces with AARP in 2018, and this one-stop shop helps people find local resources online. It provides users access to a wide range of local dementia care services available to meet their immediate needs and help them plan for the future. Some examples of services you can find in the Community Resource Finder are scheduled association programs and services, care at home, community services such as adult day centers, elder law attorneys, and transportation. And you can also search for providers nearby based on distance and those that make home visits. We also have a new Dementia and Driving Resource Center. Here you can learn about the importance of losing the ability to drive and how you can actually deal with that with your loved one and handle that in a way that helps them to navigate this as smoothly as possible. For people in the early stages of Alzheimer's, it's never too soon to plan ahead for how you will get around when you can no longer drive. So putting a plan in place can be very empowering and a way to make your voice heard. In addition, we also have new person-centered dementia online training for professionals. We're very much excited about this. It's a new opportunity for professional care workers in long-term care and community-based settings to receive quality care training and certification based on the nationally recognized dementia care practice recommendations. This online training educates professional care workers on current evidence-based, person-centered practices to care for individuals living with dementia, and it includes interactive exercises and videos from real care providers and those impacted by Alzheimer's or other dementias. The purchase of the Person-Centered Dementia Care Training Program also includes access to Essentials, which is an individual certification exam that demonstrates knowledge of quality care dementia practices. And moving forward, we also are very concerned about the public health impact of Alzheimer's. There's a very powerful quote by David Satcher. Alzheimer's is the most under-recognized threat to public health in the 21st century. He was the former US Surgeon General and former CDC director. More and more communities around the country are taking a public health approach to address Alzheimer's, which is a pivotal public health issue requiring bold action as the crisis grows. With the number of Americans living with dementia growing and growing fast, robust public health responses are needed to mitigate these future impacts. Alzheimer's and other dementias have become a public health issue because the burden is large, the impact is major, and there are ways to intervene. In terms of the burden, today nearly 6 million Americans are living with Alzheimer's, and the annual cost of caring for them exceeds $250 billion. The burden is only projected to grow, and by 2050, as many as 14 million could be living with Alzheimer's, with costs exceeding $1 trillion. Federal and state governments shoulder 2/3 of the cost of Alzheimer's through Medicaid and Medicare. Regarding the impact, more than 1/4 of all hospitalizations of people with dementia are preventable, at a cost to Medicare of nearly $2.6 billion in 2013. In addition, 95% of people living with Alzheimer's and other dementias have at least one other chronic condition, such as heart disease, diabetes, or stroke. Alzheimer's complicates the management of these chronic conditions, resulting in poorer health outcomes and increased healthcare costs. Alzheimer's impacts more than just the individual with the disease, and we know that well. More than 16 million family and friends provide over 18 billion hours of unpaid care annually, resulting in an additional more than $10 billion in increased healthcare costs due to the burden of caregiving. For intervention, we know that a strong public health response can mitigate the future impact of Alzheimer's by utilizing common public health tools and techniques. These include early detection and diagnosis, reducing risky health behaviors, collecting and using surveillance data, developing workforce competencies, and mobilizing partnerships across entire communities. These population-level interventions help improve the well-being and quality of life for people living with Alzheimer's and their families, and reduce the costs associated with Alzheimer's. Our next slide is a very powerful graph. It shows you how prevalence and associated costs are dramatically rising and are expected to continue doing so for the foreseeable future. The purple line shows you that the aging of the baby boom generation, the number of Americans aged 65 and over with Alzheimer's, is expected to dramatically escalate from 5.5 million in 2018 to 13.8 million in 2050. At the same time, the cost of caring for individuals with the disease will also expand in lockstep. In 2018, caring for people with Alzheimer's and other dementias cost society an estimated $277 billion, including $186 billion by the government for Medicare and Medicaid. In 2050, cost to society of caring for people with Alzheimer's will total of $1.1 trillion, with the cost to Medicare and Medicaid totaling a combined $750 billion. And that's in today's dollars before inflation. This clearly is a growing public health issue. And while new medical interventions to treat and cure Alzheimer's would lower the trajectory, we know from successes with HIV and AIDS, heart disease, and cancer that public health has a role to play and can help to contribute to reverse some of these numbers. The life course perspective, and public health roles of Alzheimer's are a way for us to look at this framework and how we can address it. Public health works to improve the health and well-being for the whole community at any stage of life. And while historically, Alzheimer's has been viewed primarily as an aging issue, today we understand that the brain changes associated with Alzheimer's and other dementias take root many years, even decades before symptoms appear. That's why a life course approach to Alzheimer's and other dementias is needed, and why we need public health involvement. After all, public health is actively promoting health at all ages and stages of life and uses population-level strategies to change outcomes. Throughout the dementia continuum, the public health community can intervene by promoting health behaviors to reduce risk of cognitive decline, encourage early detection and diagnosis of cognitive impairment and dementia, improve the quality of care for and safety of people impacted by dementia in their communities, and very importantly, also attend to caregivers' health and well-being. These essential public health activities help reduce burden, improve health outcomes, and promote health and well-being among both people living with dementia and their caregivers. In terms of risk reduction, expert panels have called attention to traumatic brain injury, smoking, physical activity, control of cardiovascular risks, including diabetes and hypertension, and other modifiable factors that correspond with an overall healthy lifestyle. Recently, the Sprint Mind study demonstrated it's possible to significantly reduce mild cognitive impairment through aggressive lowering of systolic blood pressure. Regarding early detection and diagnosis, the earlier that Alzheimer's and other dementias are diagnosed, the sooner people and their families can receive information, care, and support. Both studies indicate that less than half of people with dementia have been diagnosed by a physician. In the past, public health has used its levers to change policies, systems, and environments to improve early diagnosis of cancer, cardiovascular conditions, and infectious diseases to improve outcomes. And we need the same for Alzheimer's. Regarding safety and quality of care, CMS data indicate that more than 95% of people with dementia have one or more chronic conditions. Alzheimer's complicates the management of these other conditions, resulting in increased hospitalizations, some of which are avoidable, and costs. Effective management of comorbidities needs to take into account both the person's cognitive functioning, including diagnoses of dementia. Also, public health can make sure caregivers have the support and education they need to minimize injury risks and provide effective care. Regarding dementia caregiving, about 1 in 3 Alzheimer's caregivers report their health has gotten worse due to care responsibilities, compared to 1 out of 5 caregivers of other older adults. Public health could also work with partners to monitor access and to improve use of affordable, evidence-informed services, programs, interventions, and supports to reduce stress and improve coping, self-efficacy, and overall health. The Alzheimer's Association is also one of the world's leading Alzheimer's advocacy organizations. We advocate for critical research, prevention, and care initiatives at the federal, state, and local levels to ensure that families affected by Alzheimer's are not forgotten by our government. Public policy and advocacy efforts have been identified as a critical lever to advance our mission and vision at the Alzheimer's Association. The reason for this is because through public policy, we can reach the masses of people impacted by dementia today and for future generations. The only way to do this is to empower volunteer advocates to amplify their voice of Alzheimer's and all dementias. Our advocates are truly the heart of our public policy operation, and it's because of them that the Alzheimer's Association is the leading voice for dementia advocacy, speaking up for the needs and rights of all those affected. Fully achieving our mission is only possible with the substantial changes in federal and state policies, and our grassroots advocates are the linchpin in this process. Advocates are core to all of our policy successes throughout our history and will remain the key to our public policy successes in the future. Our 2021 federal policy priorities include the Comprehensive Care for Alzheimer's Act, the Equity in Neuroscience and Alzheimer's Clinical Trials Act, also known as ENACT, increase Alzheimer's research funding at the National Institutes of Health, and also funding Alzheimer's public health infrastructure, which is also called the BOLD Act, and the Alzheimer's Caregivers Support Act. There is an urgent need for our federal and state lawmakers to act quickly to help slow and reverse the trajectory of this disease, and the Alzheimer's Association has developed a robust and bold 2021 federal and state public policy agenda to help in doing so. At the federal level, the Comprehensive Care for Alzheimer's Act has been pivotal in terms of mobilizing our efforts and our advocates across the state and across the country. Comprehensive dementia care has been shown to reduce costs while providing better quality care. Unfortunately, dementia care management programs have not developed within the current Medicare fee-for-service system. The Bipartisan Comprehensive Care for Alzheimer's Act would ask the Center for Medicare and Medicaid Innovation to test a different payment structure for dementia care management. This important bill has the potential to streamline today's complicated healthcare maze for people living with dementia and their caregivers. Regarding the ENACT Act, Alzheimer's and other dementia disproportionately affect older Black and Hispanic Americans compared to older whites. In fact, Black Americans are twice as likely to develop Alzheimer's, and Hispanic Americans are more than 1.5 times more likely to develop the disease. Yet much of Alzheimer's research to date has not included sufficient numbers of Black, Hispanic, Asian, or Native Americans to be representative of the US population. The underrepresentation of these populations not only hinders the ability of researchers to understand these health disparities, it also restricts their knowledge of how an approved therapy or diagnostic may affect the populations most likely to need the treatment. The Bipartisan Equity in Neuroscience and Alzheimer's Clinical Trials Act would increase the participation of underrepresented populations in Alzheimer's and other dementia clinical trials by expanding education and outreach to these populations, encouraging the diversity of clinical trial staff, and reducing participation burden. Regarding appropriations, while significant progress has been made, current funding levels for Alzheimer's research at the NIH continue to fall short of the total funding scientists and the U.S. Advisory Council on Alzheimer's Research, Care, and Services believe is needed to meet the goal of finding a treatment or cure for Alzheimer's and other dementias in 2025. We are asking Congress to continue its commitment in the fight against Alzheimer's and other dementias by increasing funding for Alzheimer's research by an additional $289 million in fiscal year 2022. In addition, we're asking Congress to fully fund the BOLD infrastructure for Alzheimer's Act at $20 million, authorized in law for CDC in FY22. This funding will strengthen the public health infrastructure across the country by implementing effective Alzheimer's interventions, such as increasing early detection and diagnosis, reducing risk, and preventing avoidable hospitalizations. The Alzheimer's Caregiver Support Act is also very important. An estimated 11 million Americans are providing unpaid care to someone living with dementia, and they need our support. While providing this assistance can be rewarding, it's also quite challenging for the caregiver to sustain. The bipartisan Alzheimer's Caregiver Support Act would provide much needed relief for our nation's dementia caregivers. In 2021, we also have Pennsylvania-specific policy priorities, and they include the Increased Early Detection and Diagnosis to Improve Care Planning and Quality of Life Act, which was passed in the House and is now in the Senate, the Equip PA with a dementia-capable workforce, enhance PA caregiver support program, and protect residents in long-term care settings from COVID-19 and social isolation. And right here in Pennsylvania, our policy and advocacy team works closely with our state elected officials to have new laws introduced and raise awareness around Alzheimer's, and we provide solutions to Alzheimer's and dementia-related public policies. We've already seen some incredible advancements in our 2021 Pennsylvania priorities. These include increased early detection and diagnosis to improve care planning and quality of life. The House Bill 1082 would call on the Department of Health, in collaboration with the Department of Aging and other public-private organizations, to establish an education program for primary care providers that will underscore the value of an early diagnosis of dementia for patients and their families, and provide them with supportive tools necessary to assist in the detection, diagnosis, and care planning referral. The legislation would further increase understanding and awareness of cognitive decline, Alzheimer's disease, and dementia to the general public by incorporating information about the disease into existing public health outreach programs. We're excited to say that House Bill 1082 just passed last week in the Pennsylvania House of Representatives and is now before the Senate for consideration. Also, the equip Pennsylvania with a dementia-capable workforce. We're building awareness and capacity, especially in light of the impact of COVID, which is having on those living with Alzheimer's and dementia that we all know very well. There's a need for more standardized competency-based dementia training across long-term care services and supports continuum, in addition to adult protective workers and other first responders who are often the people who interact with those living with the disease when an emergency arises. We are pursuing a variety of legislative and regulatory opportunities as identified to advance us forward. The Enhanced PA Caregiver Support Program. We're thrilled to announce that Governor Wolf recently signed House Bill 464 into law. This new law will make important administrative adjustments to the PA Caregiver Support Program and adds language to be more inclusive of caregivers providing care for those with Alzheimer's and dementia. These changes will allow more flexibility and greater access to the program. And lastly, the protect residents in long-term care settings from COVID-19 and social isolation. We all know this well in terms of the impact of COVID. The association's long-term care policy recommendations released last May still remain timely as the pandemic continues and COVID-19 vaccinations are continuing to be rolled out throughout the state, and planning for the future continues. We continue to use the 4 tenets of rapid testing, reporting, surge activation, and additional support of those policy recommendations as a basis for our ongoing discussions with the Wolf administration and members of the General Assembly. And another important slide that we also want to address is to be sure that we do a call out in terms of the advocates who work so hard and really amplify the voice of Alzheimer's and all others living with dementia by becoming a volunteer advocate. Our advocates have proven success in amplifying the voice of Alzheimer's and everybody living with dementias towards successful public policy change. We know that their efforts are truly changing the trajectory of the disease by advocating for critical public policy changes and moving us closer to a world without Alzheimer's and all dementias. And the successes that I referenced earlier could have never happened without others amplifying their voices and taking action and becoming advocates. If you're interested in becoming part of the movement that's helping change in Alzheimer's and all of dementia public policy on Capitol Hill in Washington, D.C., as well as here in Pennsylvania, you can actually go online to allsimpact.org for more information. And next, I think that sets us off for any questions that anyone has. I know we provided a lot of information here today. So any questions you have, we're happy to respond.
Great. Thank you, ladies. That was great information that you shared with us today. And we are open for questions at this time. So if you do have any questions, please submit them in the question box on the right hand of your screen. And we'll just wait a couple minutes to see what comes in. We are in the process here at PHCA. We are scheduling our July and August webinars, so keep an eye out for those. They're changing regularly. We have a couple of them coming up and already scheduled, but more in the works. So keep an eye out for those that are coming up. And we also have our October convention, which will be held October 5th and 6th in the Poconos at Kalahari. So again, any questions? It was very thorough information, but it was a lot. So if anybody has any questions, please type them in and we'll get to them. And I will be sending in the follow-up emails that go out either later today or tomorrow. I will be sending out some information on how you can access some of this information. I'll be sending out the slides and again some links and numbers to get in touch with the helpline, the Alzheimer's helpline, and things along those lines. So helpful resources are coming your way. Wow, I think you guys did such a great job. This is a quiet group, and there aren't any questions coming in. So I'll start wrapping up. If we do have a question come in, I'll get that to you. Again, just a reminder for our attendees to stay on to complete the survey. That information is very helpful for us and our speakers. Today's webinar recording will be made available on the PHCA website, and be sure again to check out the scheduled webinars that we currently have planned through the remainder of the summer. I want to thank again Sara and Melanie for the presentation today. It was a lot of great information and changing information. It seems like, you know, there's always new information. So we will, in our partnership with Alzheimer's Association, be you know, scheduling and looking at how we can keep everyone up to date. Just no questions, so I'm just going to wish everyone a great remainder to your day and to your week, and stay well, everybody.
Thank you, Wendy, and thank you, everyone. Appreciate it.